everyone, I'm Grace Sells, and today we have a great episode of Best Docs Network, the show featuring some of the best doctors in the Houston area that are changing lives. Up first, we have vein specialist, Dr. Peter Morgan.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, oh, it's not going to hurt, it's not going to hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
Jack from Tomball has a question for Dr. Annie. How can airplane travel cause clots and death?
Long travel can cause venous flow to decrease, so therefore the flow in the legs can kind of pool and accumulate and not come back up to the heart. When that happens after patients are sitting for long periods on an airplane, clot can form because the blood becomes stagnant. To prevent that, we tell patients to walk the aisles of the plane, exercise the legs even while sitting, and try to stand up intermittently throughout the flight. This will protect the clot, the patient from having clot formation. What happens when the clot forms is when the patient finally leaves the airplane and gets to their destination, clot can move and go up to the lungs and cause sudden death from a pulmonary embolus. Very critical to know about clot formation, very critical to prevent it, and easy to prevent by just moving. Actually, sometimes wearing hose will help, and knowing the risk factors of flying can prevent a problem when you get to your destination.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
To request an appointment with any of the great doctors you've seen on our show today, head to our website, bestdocsnetwork.com. How many times have you heard, "Oh, my aching feet"? Well, when your feet are hurting, your entire well-being can suffer. Here's someone who can help, Dr. Gabriel Maislos.
Many present in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal. And basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad, I couldn't even wear a shoe. So that's what really made me came in, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better. No pain. It just felt better. And I was so happy, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump because first it gets red, and next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone. I
mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. A lot of people are concerned that they've heard from their neighbor or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and we've really come a long way with our surgeries.
Stretching can help boost circulation and digestion, and even ease back pain. Remember when stretching to hold each position for about 25 seconds and to breathe deeply.
I'm an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong. I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test, and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back in home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
A lot of people are on aspirin. Aspirin is good to prevent heart attacks and strokes because it inhibits the stickiness of the platelets in your blood. These platelets clump together when they get real sticky, and then they can cause blood clots. Then you get a heart attack and stroke. Aspirin stops that stickiness. Now, we used to say that anyone at high risk for a heart attack and stroke should be on aspirin to prevent those problems. But now we think we should only use it for people who have had a heart attack and stroke. We found that people who took aspirin to prevent those things, yet had never had one of those problems, a heart attack or stroke, those patients still had just the same number of heart attacks and strokes, but had more bleeding from the aspirin because it can be hard on your stomach, and had more bruising because it can cause the blood not to clot in your arms and legs, and then you'll get bruises all over the place. So if you've had a heart attack and stroke, you should take aspirin, 81 milligrams, that's a baby aspirin. Don't get brand name, get just generic stuff. If you've had stomach problems like ulcers and gastritis, use an enteric-coated aspirin. But it is true, in many cases, an aspirin a day can keep the doctor away.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
For more information and to check out hundreds of great videos, head to our website, bestdocsnetwork.com. Up next, we have ear, nose, and throat specialist, Dr. C.T. Nguyen.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more than ever. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times?
Welcome. Today we're here with Dr. David Fish, who's the Director of Interventional Cardiology at the Texas Heart Institute. Dr. Fish, thank you so much for joining us today.
It's my pleasure.
So we know that you have done so many wonderful things in your career. Today we have just a few minutes to talk about one of your great interests is transcatheter aortic valve replacement. Could you tell the audience what is that?
Well, for many patients, especially those reaching older age, often the aortic valve, which is the main outlet valve for the pumping chamber of the heart, becomes narrowed or stenotic because of degenerative changes of the valve. Ordinarily, this is a reason to do open heart surgery to surgically replace the valve. But in some cases, the risk for open heart surgery is very high for some patients. So for selected patients who have this problem and who are at high risk for surgical valve replacement, now we have techniques available and instruments available by which we can deliver a valve into the valve position through a catheter.
Wow, that sounds very amazing. For years there was only surgical option for these patients. Is this happening in multiple centers?
Yes, they're widespread now in the United States. There is, as yet, only a single commercial valve available, and the delivery systems are large and require a lot of expertise and a great deal of teamwork in order to deliver successfully.
We know that the great thing about the Texas Heart Institute is that it's a huge team of cardiologists and surgeons and support services. So we know that you are one of the great teachers here at Texas Heart Institute. Tell me what you feel about educating these students over the years. What has been your main feeling about this?
Well, we're fortunate here to have had over the years very highly qualified, very gifted students of medicine and doctors who come for their postgraduate training in cardiology here. And among these, a number selected choose to go into interventional cardiology. That is, of course, the branch of cardiology involved with putting instruments in the body and opening arteries and correcting structural defects in the heart. It's been my great privilege to have trained a great many of the operators who have gone out from the Texas Heart Institute into the community and to other places in the country and have brought
For more information, head to our website, bestdocsnetwork.com. And did you know that simply smiling more often can improve your overall health? Let's check out smile specialist Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Let's talk about grief and depression. There's a big difference. We all have grief. We lose a favorite animal, we lose a loved one, we lose a job. These are things you grieve over. Depression's a whole other thing. That's a chemical abnormality in the brain. It often needs medications to get well. Grief can lead into depression also, so it's important to know the difference. And there are several ways to know the difference. Number one, grief tends to be more short-lived. It may last a few weeks, a few months, in rare cases, years. And depression tends to last longer, more along the range of months and years. Also, and this is the most important factor, is grief tends to progressively improve. You get a little better every few weeks, every few months. You can look back and see that you're improving. Depression doesn't act that way. It tends to stay the same, stay bad, and get worse. You feel anhedonia, which means lack of joy. If you have grief, you need time, you need help, you may need support groups. But if you have depression, you may need medication. Try to tell the difference and search for help.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
It is so great to see these doctors really changing people's lives. That's going to wrap up today's episode of Best Docs Network, the show featuring some of the best doctors in the Houston area that are changing lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question or comment, we love hearing from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.